Hi, ako si Dr. Marte. Ako ay isang infectious disease specialist na nakabase dito sa Toro Hills Health Center under the Quezon City Health Department as medical officer. Mahalaga ang community quarantine during this COVID-19 outbreak dahil nare-regulate nito ang mobility ng mga tao, no? But it allows yung essential services to be open or pwede pa nating ma-access. Like yung grocery nga, yung mga medications, yung food, no? Pero kung hindi naman essential, no, na movement ng mga tao, kagaya magmo-malling lang, pupunta sa park, mag-outing lang with family, eating out, yun, kailangan talaga we have to regulate the movement para hindi tayo makaspread ng virus sa iba. During this COVID outbreak talaga, ang pinaka very important take-home message talaga is number one, we have to practice cough etiquette talaga. So kung meron kang ubo, sipon, any respiratory symptom, you better stay home. If you think you are ill, better stay home. And then, kung lalabas ka man, you have to wear a mask, no? You have to bring with you a handkerchief, or mas maganda na nga, it should be a tissue, no, that you can dispose of once used. And then, as much as possible talaga, magdadala po tayo ng alcohol or pang-hand hygiene natin so that whenever we touch mga public installations, kagaya ng mga doorknob or something na alam mo na nahawakan din ng ibang tao, we better wash our hands or put on alcohol rub sa hands natin. As a frontliner, ito talaga ang challenge sa amin is to come, no? Kasi 'di ba limited na nga yung transport. Isa 'yon. Kaya gusto mo mang pumasok pero dahil nga wala ng public transport, no? Maglalakad ka papunta doon sa place of work mo. Pangalawa, of course, when we come, we have to face this mga pwedeng suspects, ano? Na mga COVID-19, na mga suspects. But since we are already trained, no, for this job, na kami as a health worker should be here doing our job, we should protect ourselves. Of course, may face mask, meron namang kaming available PPE. So, depende lang po sa triage and screening po namin sa mga pasyente, then we can arm ourselves against the virus. Actually, being a frontliner, masasabi ko na kulang po talaga yung supply. That's why galing po talaga sa out-of-pocket talaga ang pagbibili namin ng mga face mask, no? Especially kung ang ang LGU, 4 lang na PPE ang binigay. So 4 lang at disposable yon. So 4 lang na personnel o 4 mo lang na beses magagamit yon. So kung meron akong 4 na araw at magamit ko na yon, wala na. So I have to get somehow PPE for myself if I have to encounter a COVID case. If you think, no, na meron kang kasama sa bahay na suspetsa or confirmed, no, na COVID-19 case, ito ang steps mo. Number 1, as much as possible, no, i-isolate mo yung pasyenteng yon. Ilagay mo siya sa isang kwarto and barest minimum lang talaga ang interaction mo. Kung pwede hanggang door lang, you call out lang, no, ito na pagkain mo. Doon na lang siya. Kung mag-CR siya, may sarili siyang CR, or you get out of her way kung saan man siya dadaan, no? And as much as possible po, you have to tell the barangay or the nearest health center sa'yo or a DOH hotline. Meron naman tayong DOH hotline and it's flashed palagi sa TV na you call this number if you are confirmed, if you think na you have an exposure, no, to a COVID patient, you have to call, you have to notify either the barangay, the nearest health center, or the DOH hotline na nasa screen ng mga TV nyo. And from that, so you know na you have to protect yourself. So kailangan sa lahat ng interactions mo sa taong yon, you have to wear a mask, you have to wear gloves, as much as possible, dun lang siya sa area na yon. And then, you also check for any symptoms, no? Kung meron siyang mga simptomas o ikaw merong simptomas, then you have also to report that. And then you leave the contact number so that matawagan ka naman, no? Pabalik. And then as much as possible then you disinfect the house. No, hindi lang yung sarili mo, hindi lang yung suspect nyo na COVID-19 suspect, kundi the whole house you should disinfect with bleach. 1:10 ang kung 1 ml, hindi 10 ml. Kung 1 galon ng bleach, hindi 10 galon na tubig. Ganun siya, 1:10. Ito lang talaga, we should obey the authority because they see the whole picture. Tayo sometimes, ang nakikita lang natin, yung kalagayan lang natin, yung sitwasyon natin sa bahay, yung sitwasyon ng neighborhood natin, pero actually, what is the best for us? So we should obey our authorities. Kung sinabihang limitahan yung movement po natin, limitahan po yung movement natin. And then for those who can do something, like if you have money, then perhaps you can help by giving a donation like mga face mask or food para sa mga nasa frontline, or if you don't have anything, wala naman, prayer po talaga. So we really need your prayers in this time of crisis po, and please stay healthy po kasi we also care for you.